This video is all about CAR T-cell therapy, a special immunotherapy that can be used under very specific conditions. And with that, we're already right in the middle of the topic, because at the moment, this treatment is only carried out in children and adolescents with a so-called B-cell leukemia. B-cell leukemia is normally treated with chemotherapy, which also works in most cases. But sometimes, doctors see only a small chance of a permanent cure with conventional treatment because standard therapies don't work. In such cases, a CAR T-cell therapy can then be used. Now we first want to find out what is CAR T-cell therapy anyway, and how does it work. As mentioned, in pediatric oncology, it's used to treat a very specific form of blood cancer in which certain white blood cells, the B cells, multiply uncontrollably. To help you visualize this better, we've prepared something else. So, since the diseased B cells come from one's own body, they aren't recognized as something dangerous by the immune system. They are therefore protected from attacks, virtually invisible. But B cells have a very typical feature that identifies them as B cells. This is namely the CD19 antigen. That's a protein molecule that sits on the cell surface. And now the CAR T-cell therapy comes into play. For this therapy, another group of white blood cells is used, the T cells. These are normally responsible for tracking down and eliminating disease cells in the body. But as mentioned, they don't immediately recognize the diseased B cells as the enemy. So what do you do with these T cells so that they recognize and attack the diseased B cells? The T cells are removed and taken to the laboratory. And there they get a kind of upgrade, right? Upgrade means that they are genetically reprogrammed to form a receptor on their surface, so they get a new recognition site. And it looks something like this. So this receptor that's on here now, it's called chimeric antigen receptor, or CAR for short. Chimeric, by the way, means that this receptor is composed of different components. The CAR or CAR is thus introduced into the T cells. And on the surface, the CAR then pops up as a new receptor. And this receptor is made so that it recognizes a very specific target structure. Up here. That symbolizes here a specific target structure on the cancer cells. And you've already guessed it, that's the CD19 antigen. This one here. So, like two puzzle pieces. Click. Looks about right. Fits together perfectly. So if you now put the souped up CAR T cells back into the body and they buzz around in there, and when they meet the cancer cells, the puzzle pieces connect and initiate the destruction of the cancer cells. Mission accomplished. Well, I think that should make it roughly clear how the whole thing works. So we've already managed the theoretical part with that. Now, of course, the question remains, what does it look like in practice? Yes, so how is the therapy actually carried out? As mentioned at the beginning, the prerequisite is of course that the cancer cells also have the CD19 antigen. Yes, that is the basis of the treatment. Therefore, an examination takes place beforehand to determine if this antigen is present as a target structure. If that's the case, the T cells must first be filtered out of the blood. That happens in a kind of blood washing. During this, the patient's blood is passed through a machine for about 3 hours. Then the T cells go to the lab, and there they are genetically modified into CAR T cells. And those CAR T cells are then multiplied, frozen, and finally go back to the clinic. And this whole process, it takes its time. Overall, it can take up to 8 weeks. The CAR T cells are then usually administered through a single infusion, but before that happens, the young patient is already admitted to the ward the week before. And he or she then receives a low-dose chemotherapy. This is to prepare the immune system for the new super T cells. This way the old immune system is significantly reduced, so that the new immune cells have as little competition and enough space to spread. Only then does the reinfusion take place. About a week later, the new immune cells then multiply very quickly in the blood. And then they set about, hopefully knocking out every single cancer cell, and a small amount of CAR T cells suddenly becomes many billions. That's exactly what's intended, but it can also be dangerous, because the body is not used to such a strong activation of the immune system. And the CAR T cells can trigger a so-called cytokine storm. That is a violent inflammatory reaction that puts a strain on the whole body. It can lead to fever and in some cases even make a stay in the intensive care unit necessary. Neurological symptoms such as tremors or confusion can also occur, but these usually improve quickly. and there are now also very good medications to counteract a cytokine storm. Another side effect is that CAR T cells cannot distinguish between malignant and healthy B cells. B cells are very important defense cells. They are responsible for producing antibodies that protect us from infections. If B cells are missing, then antibodies are also missing. But this can be treated by regular administration of antibodies so that the body continues to be well protected. Well, in any case, such and other side effects are also the reason why this therapy is only carried out in highly specialized centers. But at the same time, the various side effects are now well known today, and doctors quickly know how to manage them with the appropriate therapy or medications. This also means that anyone treated in a hospital that doesn't offer this therapy will naturally be referred to a specialized center in the case a CAR T cell therapy is recommended. Pediatric oncologists are well connected within countries and work closely together so that every child receives the best possible treatment.